And we are live. Hello, Sober Nation. How are you guys? I'm Veronica Amarante, and today I am joined by Brandy Klingman and Emily with St. Christopher's. How are you guys?
Good.
I am so excited that you guys took the time to join me today because this is a very important topic. So when I learned that you guys were going to be doing this live video on your own and hosting the training that you just hosted, I definitely wanted to have an opportunity to talk to you guys, and I'll get into what we're talking about now. So as we know, there is, a very famous person who overdosed yesterday, and allegedly, right? We can't say for sure whether or not they overdosed, but that's what the news report. And I thought it would be a great time to have a conversation about overdose prevention and, Narcan. And I know you guys just did a Narcan actual training almost live, right? And
Right.
To let our viewers know a little bit more about you guys, St. Christopher's Addiction Wellness Center is located in Baton Rouge, Louisiana. And you guys are a treatment center, but what I love about you guys is that you are so active online. You're so active on Facebook. You're always having conversations about topics that are relevant. But today you took it a step further and you did an actual training, live on Facebook. So I thought that was amazing. And that's, again, the reason why I wanted to have you guys on today, so we could talk about Narcan and so that we can talk about, overdose prevention. And Brandy, I know you're the COO there and you're a master clinician. So I know you have that down, but I know Emily is the director of nursing, and I know you're more hands-on when it comes to, Narcan and dealing with the patients and having that kind of contact. So why don't you guys kick it away and kind of tell us, what you do there at St. Christopher's?
As a facility, what we do, or like individually?
Yeah, as a facility, and how you deal with overdoses and also Narcan.
Yeah, okay. Well, we can definitely do that. I love our facility. I love to talk about it. We're an all-male treatment facility that treats everything from, we have all levels of care from detox to outpatient IOP. We believe in long-term treatment, and we believe in a comprehensive multidisciplinary treatment approach, meaning that all angles of the person should be treated, their health, their emotional, spiritual, physical well-being, as well as the addiction. And the multidisciplinary means that we believe that there should be more than just addiction counselors or just doctors. So we have people of all different varieties of clinical experiences or life experiences in a lot of cases involved. So that's kind of what we do in general. But what we're doing with our social media and our community integration is we have committed to changing how our marketing dollars go. Our marketing dollars have historically been to like self-promotion and a lot of stuff about sponsorships and co-sponsorships and that kind of stuff, putting your name on things. And really what we want to spend more money and attention on is community outreach, advocacy, building awareness and insight to decrease the stigma of addiction and increase the accessibility that people have to treatment, not just at St. Christopher's, but all over the country. So that's really what my mission is within the agency, and what St. Chris's goals are as far as getting more people involved in good, healthy treatment and understanding all aspects of recovery. And Emily can talk a little bit about like what we do as far as medically and how we handle all different types of patients.
Right. I think what makes us a little bit special and unique is that we encompass a long-term type treatment philosophy that starts with the highest level of care. We have a detoxification center where we actually can have clients coming in who need medical withdrawal from whatever substances it is that they are using at the time, to where we can safely medically detox them to get them to a place where they can receive the real treatment of where it really begins, which is, with the 12-step approach and the therapeutic approaches that come with that. So we have a 24/7 medical staff who is on site at all times. We have multiple physicians that we can consult with and who consult with us that do not only the detoxification, but once you step down from that and are actually detoxed medically at that point, who follow you through your treatment. So I think that's what makes us really unique and very dynamic, because of the fact that we can carry not only the medical component and the therapeutic component along with the 12-step and kind of really hit you from all sides. So I think that's really what makes us so special in that.
Yeah.
Yeah. And I think like I wanted to start out with an introduction about you guys, because I know, you know, from working in the industry, you guys are very popular and very well respected, but I wanted the viewers to get to know, kind of get a sense for, you know, who we're going to be talking to, because I am going to get into it and ask you guys a lot of questions. And, you know, obviously I needed them to know that you guys do this every day and you know exactly what you're talking about. Because, you know, a lot of people, and again, I love the fact that you guys are so transparent when we talk about, you know, any topic. But specifically, I know earlier when you were doing the Narcan training online, you talked about having to use Narcan in your treatment center. And I don't know how many, you know, other people would say that, you know, on a live on Facebook. So again, I want to
guess how many people actually do have to use it. If you have a treatment center, you could guess that it's not just us that have people showing up in an overdose state or who relapse on site, you know.
Yeah, no, and that's the reality of it. And I think, you know, there's this movement now of people being more transparent when we're talking about removing the stigma and having a conversation about what's really going on. And instead of us getting on here and talking again, you know, about somebody overdosing and talking about the celebrity and the whole, you know, story or glamour out of it. There's nothing glamorous about it. This is happening every day. We're losing way too many people, and we need to start having more conversations about what we can do to not only prevent those overdoses, but, you know, what's available. What do we do if we don't have access to professionals? What do we do if we're not under medical care? And so that's what I'm really excited to get to talk to you guys about, especially Emily, because I know you were so hands-on in your training. And I will post a link for you guys of the video where they did the live training. They demonstrated how to use Narcan in its different forms, because there are different forms that it comes in. So you guys went through all of that in your video, and I'll post a link later so you guys can check it out. But in the meantime, can we talk about like what Narcan is? A lot of us, you know, are familiar with it, but for those of people watching that may not know what Narcan is, Emily, can you tell me like what the medicine itself is?
Sure. Narcan itself is basically what we call an opiate antagonist. So basically what it does is it goes in and saturates the cells that are that can be attached with the opiates that can cause that euphoria, cause the high and everything, and of those, and it actually can reverse the overdose effects of an opiate. So basically it saturates, if you could think of it as a ball, it basically saturates that cell to where there's no more that can actually attach to it, because it can't hurt you if it's not attached, so to speak.
Yeah. And so when we are thinking like, how do we even know somebody's overdosing around us? Like, are there any signs where we can say, okay, this person's not okay?
Right, absolutely. What you'll typically see is somebody who's in potential overdose. You'll see very their respiratory status is hindered significantly. They may not be breathing at all. They could be breathing very shallow. And when I say shallow, it's just what we call non-productive breaths, to where it's very, the chest doesn't rise nearly as much as it should, which means the lungs are not filling up as much as they should in order for the lungs to be able to produce oxygen throughout the body. Thank you.
Sorry.
No, it's fine. So you'll see that you'll actually sometimes some people will actually breathe real heavy, or they'll have like just extreme difficult breathing, pursed lips. You'll see a change in their color. They can become sweaty and pale, sometimes blue. And if they're blue, that means they're not breathing at all, and something needs to be done immediately.
Like, and when you say blue, it's like it's, you know, the fingertips, around the mouth, you know, those are the parts that kind of lose oxygen first and kind of turn a little pale blue.
That's exactly right. And what you can actually do to kind of see is you can kind of touch around on their body to see how much refill is coming to the surface. If it stays pale once you're touching it, then that means that there's really nothing circulating. So you want to make sure that you
she's talking about like doing like this, touching my skin, and you may not be able to see it in this video. You're going to see when you touch your own skin that it turns white, and when you lift up, it goes back to color. When you don't have enough oxygen, when you touch it, it goes white. It does not come back quickly to color. So that's what she's talking about. For everybody who's non-medical,
I'm sorry.
we're all
What?
I saw Veronica touch her own skin too. So
I'm doing it right then and there.
But it's not going to be. It's going to be on your core areas. It's not going to be. You don't want to do it on the arms necessarily, on the legs. You'd want to do it on the core area, their face, and even their chest. You can kind of see if the blood comes back.
Yeah.
Right. And this is going to sound like a dumb question, but there
no question is dumb?
Prevent an overdose besides like obviously not using? Is there anything anyone can do? Like if they are using, is there a way to use responsibly?
I think that's controversial. I think that there are countries who have legalization of different classes, including opiates, and that they're showing some studies coming out that there can be a harm reduction in use if legal and if other certain things are in place. So there are some studies that are coming out talking about how to use safely and with syringe exchanges, even people dealing drugs in a legal way so that they're not getting the dangerous effects that could be put in things that aren't cleared through the government and that kind of stuff. So there are some things like that, but also medicinally or medically, there are some interventions that we do for people who are likely to continue to use opiates that help prevent overdose, or it's meant to help decrease triggers or cravings, but it also can help prevent an overdose if used or relapsed. So there are medications, and it includes the main medication in it is naloxone, which is Narcan. So there are things like that we can do. And there's an injection that someone can take once a month of naloxone that's under prescription that will help if someone were to, if the goal is to not use on the medicine. The goal is to prevent use and to prevent triggers and cravings, decrease all that. But if someone's on a medication like that, we can see that the reduction of overdose has been the effect of overdose has been decreased. And also there are some variables, like if they're using other drugs other than just opiates, and that kind of stuff can, impact it in some way. But for the opiate use, that's kind of the thing. As far as the controversy of it goes, everyone's going to have to come to their own opinion. And we don't believe in pushing an opinion on that. We're an abstinence-based program, and we want people to be healthy and live their best life without use. But you are free to form your own opinion. Our goal is to create, safety as much as we can.
Right. And I think that's, the point that we're at with this crisis is that, we are having to see what else is available. Are there different methods, and even I know there's some families that have Narcan in their homes, and keep it around just in case. And, that's something we're going to get into soon to talk about, how to use Narcan. Is something that I want to ask you about, Emily. But what should someone do if you see someone overdosing and they meet the signs that you just described?
Well, from my professional opinion is that just to put the information out there, there is really nothing that you can do with Narcan as you give it. Question, no question. People are in crisis mode. You don't want to have to think about it. And what I'm telling you is that Narcan is a drug that is not going to be harmful if given without an overdose. You won't hurt anyone. You can't overdose anyone. It's basically a drug that is going to be buying you time to get the necessary medical persons in order to potentially save the life. So it's a buying time type medication that you cannot hurt someone by giving. So if you are suspectant of someone overdosing, I would have no hesitation in administering it immediately.
Okay, that's good to know, because I know in my when you think of an overdose and having to revive someone, you think of that scene in like Pulp Fiction, and this is nothing like that, where you're having to stab someone in the heart. This is a little bit different. And I think, again, these are the kind of conversations that we need to start having, because they're happening so frequently, and they're happening, next door, with our neighbors and people that we never thought, could have,
mother, father, sister, brother, this is what who's dying.
And so, it's crazy, but like it's gotten that bad where, and I know you guys were talking to the paramedic, and he was sharing the people that he's had to treat. And, it just blows me away, even though we're all aware of the problem, like it blows me away when I learn some of the details. And I also do want to take a moment and just acknowledge the people leaving comments saying that they've lost loved ones to an overdose. We're so sorry for your loss. Like, I can't.
Yeah, I see that, Ken. And I wish that someone had Narcan for your cousin.
Yeah. And hopefully, that's the case, that this is so available. And then you guys can educate me on this, because I don't know how available it is. Whether, can we just walk up to a pharmacy? How do we get access to Narcan?
Yeah, I can talk a little bit about that. I wanted to add one more thing to what Emily had said about, you were saying what to do if someone's overdosed, and her answer is to give it. And of course, we encourage you to go back and watch. We did an extensive video on how to administer the different types of drugs and covered all that. And we appreciate if you share that, because I think that that's going to save some lives. But the second part of giving the Narcan is following up by getting medical care. Absolutely. Because Narcan will only stay in the system for so long. And there was a recent musician, I'll just say Prince, was rumored to have overdosed on opiates and landed his plane, got a dose of Narcan, and then when he returned home, he had died the next day of an overdose. And what happens in a lot of times, and I think I'm remembering that correctly, but and I don't know for sure if that this is exactly how it goes, but a lot of times what happens is we administer Narcan, or whoever administered Narcan, and they're afraid of going to get the rest of the medical help, or getting locked up in a treatment center or a hospital or something like that. And so they come back after a Narcan dose, but they don't realize that the opiate that they ingested, either orally or intravenously, is still in their system and still will impact them later. So it may not have, they may have injected one time, they may have injected 3 or 4 times. So the Narcan is coming in and hitting that first use and will wear off, and that second use will then come and hit you, that second wave. So you do need to seek medical help afterwards. It's not a treatment. It's not going to suffice as enough all of the times. Sometimes it will work, and not all of the times will it be enough. You do need to seek medical help right after that, because it can wear off. It does only stay in the system for so long. And that part really is scary to me when I think about everybody, having access. I love that part, everybody having access, but the idea that they think that taking one and one nasal spray and then coming back, that's the end of it. That's not the end of it.
I'm so glad you hit on that too. What I did leave out, again, it's in our video that is going to be posted at a later time. But the half-life, and what we call a half-life, is basically how long a medication stays in your system, is very short for this drug. It's actually only 30 to 45 minutes. So what you'll see is you'll see an immediate, between probably 1 to 2 minutes, you'll see a reaction if the Narcan that the first dose given was enough to touch on the overdose. You'll see that they come back, and you think that everything's great and everything's fine, and that's the end of it. But in reality, that's the dangerous part, because of letting the guard down in that moment. Immediately they can turn right back into the same state that they were in
within a couple of hours.
It's not even a couple of right. It's not even a couple of hours. Like, they can turn fairly quickly if the first dose wasn't enough. So what Brandy was saying is so very important, is that that's only the beginning. It's the true, core of what this is like I was saying before, is to buy time, but it's to get those medical people in to intervene even more so, which could be even more Narcan at that point. So you're not out of the woods yet with just that one dose. And if they are coming around, that's great, but you still really want to monitor for the effects of the overdose even after that's been administered. So I'm glad you said that. That's a good point.
Yeah, me too, because people do seem to think like, oh, okay, you just take the Narcan and keep it moving. No, like you are supposed to have a medical assessment, see if, because nowhere basically, not only that, but then sometimes they return to using. And on top of the fact that I didn't know that. I didn't know that that was basically just for like a couple of minutes and then that could all come right back, or God knows what can happen. So absolutely. I definitely think, you know, and some of the stuff that I've seen, they have, you know, I think first responders especially, you know, always say, make sure you call first responders, even if you have Narcan, even if, you know, the person is back, make sure you still call 911 so that we could do, you know, follow up. But now I understand more after your explanation why they say that. I didn't, oh my gosh, how many different kinds of Narcan are there? Because I know you guys, in your demo, you showed a few different, you know, options for Narcan.
I don't know exactly how many types, but I know that there's a few routes of administering. And the ones that are most available to the layperson are going to be like nasally, like a nasal spray. And it can look a few different ways. But the way that it works, you had said, how do you get it? It's a open prescription. So you can go to a pharmacy and seek Narcan. Now, before we did our video, we called trying not to wear out our source of Narcan. We didn't want to waste any, you know, we called a few pharmacies and they were out of the nasal spray, or the nasal spray cost anywhere between $120 and $150. It was, you know, it was very expensive if they carried it. You do have to give your name, you know, to the pharmacy in order to get it. They, you know, they document who got the medication, which can be intimidating or frightening for some people who are active users. But it is an open call. You can go and get that at any pharmacy that has it, and you do have to pay for it. There's a cost involved, unless you can get, there's some organizations that are giving it, you know, through grants and all that kind of stuff and giving that out. But as far as the different forms, there's several different forms, and the most common one that you're going to see is the nasal.
Right. You know? That's going to be the most common that you that for the layperson that you'll see kind of out in the community in non-medical type facilities. When you do hit those medical type facilities, you'll also see like IV or like intravenous, where they put it in the vein, and also you'll see intramuscular, where it's all an injectable, to where you would actually inject that into a large group, muscle group.
Yeah. And I have the nasal spray is going to look similar to an Afrin. You know, it's going to have a preloaded amount of how much you're going to be able to spray. You're going to spray it in the nasal cavity, and that part's going to look a lot like an Afrin. And then the one that the EMS guy just brought out was this type, and this is another nasal spray, and it comes in two parts. You put it together. You can watch the video. We could show you, but you know, essentially you're spraying it just like you would, you know, anything else. And if you can see that, that's the water coming down, you know, of medication going up the nasal cavity. So that's the most common kind. And then they have the EpiPen sort version of. Right,
which would be the same as like an injection, an intramuscular injection. But what I did want to say is that for the layperson, using this nasal version of Narcan is that although it's the least invasive, it's actually probably one of the most effective, other than maybe intravenously, because of the fact that the medication absorbs quickly into the mucosal membranes of your nose, which actually disperses through your body quicker. So you'll actually have a quicker response time than you would with the muscular injection.
Okay. Yeah. And another thing that I love that you guys, you know, touched on your video when you were talking about Narcan was, you know, you're talking about families having access to it, and kind of like almost like this sort of belief that some people may have, that because they have Narcan, they can go ahead and use more and feel like, oh, well, I have Narcan just in case something happens. And, you know, kind of like the, you know, that mentality of thinking, because I have Narcan, I can go ahead and use that as some sort of backup. And I loved, you know, that how you guys broke that down, and obviously like why you shouldn't feel that way. But can you talk a little bit more about, you know, why one shouldn't think that just because you have Narcan, it's okay to take more risks?
Well, there are different situations that you find yourself in. So when someone's using, they're not always in the, most appropriate mindset to have steps, written out to where if this happens, I can do this and so forth. There's times whenever you're overdosing and there's not an ability, you don't have a physical functionality and ability to actually administer it. So typically people can use together. So you don't know to put that responsibility on someone else and vice versa. You don't know necessarily where you're going to be as far as ability wise to even administer it. So that's just one part. If you wanted to speak to.
Yeah, I think the other part is the way that we've seen, over different studies is that Narcan hasn't increased use. On the streets or anything like that. We haven't seen any connection or correlation between Narcan and an increased use. What we have seen is the difference between Narcan and the amount of deaths. So like what we were talking about on our video was in East Baton Rouge Parish, we're in Louisiana, so we have parishes, or if you would know as a county, we had 821 doses of Narcan given to 624 people last year. And only, I think it was 75, it was an increase in deaths, but it was, like 111 deaths. So if you think 624 people could have died, those were prevented because of Narcan. So some of the myths or the thoughts that if you talk about Narcan or if you legalize Narcan, give Narcan, that it's going to create more addiction, that's simply not true. We haven't seen any studies that support that. And I think that's more of a connected to the stigma, which I know Melinda's saying stop the stigma, and that's part of the stigma of Narcan, of just substance users in general. So I really, if people are still thinking that, I'm telling you as a professional in the field, that's not connected. We don't see that. It's also not an abusable medication. It does not create dependency. People are not abusing Narcan on the streets. That's not how it works. And what Emily was talking about with people overdosing and not having the right mindset, I know that all of you out there have seen videos on social media of someone passed out in their car or on the sidewalk or in the store or at work from an overdose. And those people didn't have the choice of even getting off the sidewalk or parking their car, when their overdose hit them, much less the forethought to find the Narcan and get it. So when those people, and also just a side note, I hate those videos. I think that they're made to make fun of people who are addicted and all the people laughing, I think that's terrible. And I'm secretly judging you in that way, the people laughing at that.
So horrible. I hate those videos. Like, why not help the person instead of taping them or recording them? Like, it's so upsetting to me.
And I do understand they're upset too. The people seeing it are upset and they're worried about their kids and the people that, are affected by the overdose. I get that part. But so my point for that whole video thing is that person that's fallen out on the sidewalk in an overdose cannot administer Narcan to themselves.
Right.
The Narcan is meant for when they are feeling an oncoming thing or there's someone with them that can administer it, that kind of thing. So we're really trying to just save the life with the Narcan and not promote drug use or encourage drug use, and there's no affiliation with that. Absolutely.
Right. Yeah, no, definitely. I don't think, I hope people don't feel that way, that, encouraging or promoting Narcan is, people encouraging that people use or anything like that. I think at this point, it is about saving lives and, it is preventable. And hopefully, this is something we can start to get a handle on and people can find their way towards recovery. I know, I think more communities are becoming more vocal about, recovery. I think we are making some progress in certain areas. I think in other areas, sometimes it feels like we're not making much progress. What do you guys think? And what are you seeing on the treatment side?
You mean, are we making progress in the epidemic or?
In the epidemic as a whole?
I don't know that we are making a huge amount of progress. I think that there's a lot of people throwing a lot of things in the pot right now, trying to see what works. I don't know that we're making a huge amount of progress on the epidemic side. I do know that we're making progresses with treatment. Like, we're coming a long way with helps of things like Mental Health Parity Act and the Affordable Care Act afforded people to have mandated that people have substance abuse treatment coverage on their insurance. So that afforded people more accessibility to treatment and options like that. So we are seeing people recover. That's the message of hope. And the other part that I say about the opiates, I don't think it's getting better. I'm worried that it's getting worse. We're trending higher this year than we did last year, and our trend line should only increase exponentially next year. So we're not tackling it through legal ramifications. We're not tackling it through Narcan, and we're not tackling it necessarily from the minimization of the pain medication prescription. We're hoping to see an effect of that pretty soon, and a correlation with meaning like that we would go down with opiate addiction with less people prescribing or more prescription oversight. But we haven't seen that yet, I don't think. I mean, what are your thoughts?
No, I think that, as speaking to the prescriber part of it, I think that there are, there's lots of research, and just from personal experiences being in this field and even other fields, but medically, seeing so much lack of knowledge by some of these physicians that are actively writing these prescriptions when there are other avenues to go about in certain circumstances. I don't want to make that a generalization, because there's certainly circumstances in which that's certainly medically needed. But my hope is that, we have seen a lot of legislation coming down with the prescribers, and there's a lot of things changing in the medical realm for that specifically. So my hope is that we will start to see a little bit of a trend downward in this epidemic, based on that specifically, because I do feel like that is a while it's not all encompassing, I do think that is an extremely important place to start. So.
Yeah, and I think too, what she's talking about with the prescribers of the opiates and the pain pills, I think it's just as important to understand that most of our medical providers or counselors or mental health specialists aren't educated in addiction.
Right.
And so that part, if we increase the education of the people who are providing the help, I think you will see even more improvement with that. I know a lot of physicians know nothing about addiction, know very little about addiction, same as mental health providers. I know I got my master's program, graduate program without ever having to take an addiction class. So, it's just, that's how it is. And they're allowed to treat you. You can walk into their office and not know that they've never taken an addiction class, So I think that that's part of what needs to be really focused on, is increasing the practitioners' competency and efficacy of interventions and decreasing barriers to treatment. And then eventually we will see more people get recovered faster.
Yeah. No, well said. Well, I think, nowadays, if you do have a loved one, who's using opiates specifically, definitely should have, a script to Narcan and at least access to it or know what to do. I think we all kind of need to just at least have that conversation, be willing to have that conversation. And that was my hope, doing this video today, is to, again, yes, we can talk about, another celebrity who, is not doing so well and who just went through this, but this is happening to many more people that are not celebrities, that are not famous, and it's going on every day, and we're not talking about it. And so I think it's important, again, that we create these spaces and have these conversations and let everybody know that it's available. Are there any resources, any places where people can go to learn more about Narcan and how to use it?
It's called narcannasal.com. Thank you. I'm sorry. It was mentioned in the video that we had just done, and it's out of my hands right now. So out of sight, out of mind in this moment. But it is in the video. It's narcannasal.com. It basically is a step-by-step instructional of how to use it, maybe when to use it. And I'm sure on that website, you can find an abundance of information specific to whatever questions that you're looking for.
Got it. Yeah, no, and I'll go ahead and, like I said, put the link to you guys' video. Again, their video has an actual training on how it works, how to administer it. And but I think you know, no matter what, you have to call, you know, first responders, get help, get professionals involved, no matter what's going on. So thank you guys so much for being here. I really appreciate you guys taking the time to do this and to join us and to have this conversation. And I will link the video in the comments section. For those of you watching, thank you so much for tuning in. If you're watching the replay, thank you for watching as well. And if you have questions for the ladies or for us, leave them in the comments, send us a message. If there's any other topic you'd like to see in the future, also let us know. We do these every now and then when we feel is relevant. We don't just want to get on and talk without a purpose. But again, I felt it was just important to have these kind of conversations again, surrounding, you know, prevention, surrounding, you know, helping people, you know, just stay alive. As sad as it is, it's happening every day. But again, thank you, everyone. Everyone stay safe and have a good night. Thanks.
All right. Thank you, guys.